Good morning, village. How you guys doing today? Good morning. Happy Black History Month. This is week 1 of Black History Month. Hey, and listen, if you're like me, man, I'm Black every day. So technically every month is Black History Month. I'm always celebrating. I'm always proud of my heritage, who I am, our experience as Black people, as African Americans. But needless to say, happy Black History Month. Hopefully you guys are celebrating. Hopefully you guys are sharing education and knowledge with your kids and family about history and past accomplishments and amazing things that we've done here in the United States as a community. Hopefully you're talking about all the amazing, wonderful things that we're doing right now at this very moment as African Americans for our communities, for this country. And so this is a great time for us to celebrate. So, hey, welcome. Last week was our first video, our very first video of Black Mental Health Channel. It's our first video. We were able to start this conversation. And so I'm glad you guys are back today to have and continue an ongoing dialogue about what mental health means to African Americans, to Black people, and how we can increase awareness, increase understanding, and find solutions and opportunities and resources for all of us to maintain a positive mental health and emotional well-being. So with that being said, Ricky, allow me to introduce myself. Hey, my name is Harold Rayfield. I am a licensed professional counselor in the states of Texas, Georgia, and Oklahoma. I function as a therapist, a mental health therapist, a mental health professional, and life coach. So thank you for this opportunity. I'm glad to be here with you. You can follow us. The Black Mental Health Channel. You can follow us here, obviously, on YouTube. You can follow us in our Facebook group, which is growing every single day, where we have more conversations, in-depth conversations about Black mental health and all of those things related to it. We got people from around the country who are contributing information with therapists, social workers, other mental health professionals, clinicians, on how we can be better, how we can do more. So this is a great opportunity to have this conversation, this dialogue. It's growing. It's going to help us as a people. And so, man, we want you to be a part of it. Subscribe to this channel, the Black Mental Health Channel. Like the video. That helps us get the word out, spread the conversation out, right? Also, hit the notifications button, right? So that way you can keep you updated on when we drop a video. We try to do it every week. And of course, please leave comments down below. I'm going to read them. I'm going to respond. We want to have this open dialogue, this conversation about Black mental health and what that means to you. Why? Because, man, you're the most important person to yourself. It's you, right? You're important, and we want to take care of you as best we possibly can. With that being said, let's get into our video today, right? So our topic for today is going to be about the big stigmas, right? Stigmas with mental health. And there's a big one, right? And it's always about mental health versus mental illness. So let's talk about it, right? We have these stigmas here in the United States surrounding mental health and what that means. You know what they are, right? We all talk about them, right? Go ahead and leave me an example of a stigma that you've heard about mental health and counseling and therapy, right? And so they are not productive for this conversation, but we're trying to reverse that trend. We want to talk about it, open the dialogue, open the conversation up so that hopefully we can help somebody, right? We can be a part of the support group that we all need so we can all be our best selves, right? So there's these stigmas out there that are really negative connotations about mental health, right? These stigmas say a lot of different things about mental health professionals that are not really good for us, right? And so we want to address them. What are some of the stigmas that I can think of, right? Man, I've heard people say, man, counseling costs too much, right? It's too much money for me to go pay somebody to listen to me. I've also heard that stigma, right? Why would I pay somebody when I can just talk to my friends, right? Or I can talk to somebody close to me or a family member, right? I've heard people say, well, you know what? Counseling, I'm a private person. I don't like opening up. I don't like talking about that kind of stuff. Matter of fact, I don't even believe in counseling. I don't believe in therapy. I don't work. Those are the things that hold us back that hold us down. We as an African-American community, we even have stigmas about counseling too, right? I don't go talk to no white person, right? As if there are no therapists that are Black, no Black counselors, no African-American mental health professionals in the social work community, right? In the psychiatric community. I mean, I don't tell people my business. They don't understand. I get the frustration with that, but we have these stigmas surrounding mental health that we got to be aware of. Man, I don't need counseling. That's for white folks, right? That's a white folks issue. That's a white folks problem. And we kind of downplay how important it is how we feel, right? Our thoughts, our emotions, our experiences. And then we lean more towards being defensive and not wanting to get help and receive help. These stigmas are so damaging to individuals and families and our communities because we all go through something, right? What you feel, what you've been through, sometimes some of the trauma, the serious thing that you've been through, those things are important. And you don't want to keep wrestling with it by yourself. You don't want to fight that challenge on how can you overcome or how can you deal with it by yourself. That becomes a heavy burden to bear, as well as the other issues that life provides, right? Life is not going to stop being life, right? And so things are going to happen. You still got bills. You still got a job. You still got a boss. You may have be married. You got kids, right? You got financial worries. You got job worries. You got career worries. So those things are all going to happen. And if we don't start talking about it, those things are just going to keep beating us up. So that's why I'm here. The Black Mental Health Channel here is to talk about those things, debunk those myths, because those are not true, right? Sometimes it can be a person's experience. I don't want to invalidate that. But in reality, there is help available. There are African-American Black professionals out here doing wonderful things for our community. And they're willing and want to help and want to support you. And so you got to be okay, right? Everything not going to be gravy all the time. Everything not going to be perfect. It's going to be rainbows and sunshine every day. That's not true, right? So when you're going to go through some things, and there are times where it may feel like you have nobody there to help you. But I want to tell you that's not true. Please be okay with reaching out to a mental health professional. So those are just some of the stigmas that we've all heard or we've seen or we've read about. We even as African Americans have specific stigmas about mental health, whether it be the professionals don't look like us, they don't care about us, they can't understand us, it's not for us, it's for them other people. It costs too much. There are tons of things surrounding mental health, right? And we want to talk about that. And we're going to talk about it all this year. We're going to continue to have this conversation. It's going to hopefully help you, help somebody who needs to go get help, right? One of the biggest ones is mental health therapy is for crazy folks. How many times you heard that, right? Right? Or you somebody in your family, oh man, we don't do counseling, we don't do therapy, man. That's for such and such. You know, we all got a cousin that's off. We all got a cousin or a nephew or aunt that's, they're a little something. They're a little this. I don't know what it is. And so we kind of put this negative umbrella and it just overhangs the whole idea of therapy and what it means and getting help. So today, let's just talk about it, right? There is a difference, a big difference between mental illness and then mental health. There's a big difference, right? So according to the CDC, the Center for Disease Control, mental illness refers to the conditions that affect a person's thinking, feeling, mood, or behavior. The conditions that affect a person's thinking, mood, feeling, or behavior. So that's more about the disorders, right? So those are serious things that a person can experience, right? That's not limited to one specific thing. It encompasses a lot of different disorders, a lot of different illnesses, conditions that a person may experience, right? So if we look at NAMI, right, the National Alliance on Mental Illness, right, it says that there are a couple of major conditions, illnesses, mental illnesses that are pervasive in the United States, right, and around the world. Obviously, we know about the first one, major depressive disorder. It affects nearly 8 million people, right? Almost, give or take, according to NAMI in 2020. 8 million people had experienced major depressive disorder, right? 8%, sorry, 8% of the people in the United States experience major depressive disorder. That amounts to, or it totals about 21 million people experience major depression. We also know about anxiety. Anxiety is the biggest mental health illness disorder that affects people, right? According to NAMI in 2020, it says that almost 19.1% of the United States population, 19% said they experienced anxiety, which amounts to almost 48 million people. That was just 2 years ago, right? So that doesn't include all the stuff we've been through in the last 2 years with the pandemic and COVID and death and loss and all of the experiences and the trauma that we've all experienced to some degree over the last 2 years, right? So major depressive disorder, anxiety, bipolar disorder, which is a different mood disorder, right? Also impacts and affects people to the numbers say nearly 3% of Americans experience or are diagnosed with bipolar disorder. But there are some other ones that are really, really prevalent, right? Schizophrenia, thought disorder, right? Post-traumatic stress disorder, which is another mood disorder when people experience or go through some sort of life trauma. According to NAMI, 3.6%, almost 9 million people in 2020, right? I keep wanting to say 19, whatever, but I'm old school, so I keep saying 19, whatever. But in 2020, nearly 3.6% of the United States, right? People in the United States experience post-traumatic stress disorder. There's some other disorders out there, right? There's obsessive compulsive disorder. There's also borderline personality disorder, which also affects, to a lesser degree, some significant part of our population. Those are the major condition disorders, mental illness, right, that a person can experience. Those are on the serious side, the serious level of the spectrum, right? That's different. Mental illness is different for us than mental health, mental wellness. That's different, right? So mental health and mental wellness is referring to your emotional, psychological, and social well-being, right? Mental illness is a condition. Mental health is your status. Just like we all have a physical health, right? Your body is in a certain status, a certain state. We all have that to some degree, whether it's positive or negative. We all have physical health. We all have mental health. We all experience it, right? Mental health is the emotional, psychological, right? That's the thoughts, you're thinking, and then obviously the social part of your well-being, your status as a human being. That's your mental health. That's important and valuable because all of us experience it. Just because you take a hit or you have issues with your mental health doesn't mean that you have mental illness. It doesn't mean that you're crazy. If you're alive, you're going to go through hard times, right? My grandma would say, everybody's going to have their day, right? Where you're going to have a hard time, where you may experience some sense, some effect, some part of sadness. It may not be depression, but you're going to experience some symptoms of depression or anxiety. Or if you've gone through a really difficult traumatic experience, you might experience PTSD. It doesn't mean that it's a diagnosable condition or illness depending upon the severity of what you feel. And so we got to get away from this stigma that, oh, if I'm not okay, that, oh, that means you're crazy, right? That means you're mentally ill. That's not necessarily the case. And even if you are experiencing some serious emotional or psychological things, it's not a bad thing. It's okay to not be okay, right? And we want to make sure we make this distinction between mental illness and mental health, which we all have to deal